We do see and hear about some parents who try unproven treatments they're finding online or social media that aren't going to work, and their kids get sick regardless. And what I worry about is that some parents may rely on these unproven treatments, and then this could actually lead to a delay in care when children need it. Now, the most important way to support your child's immune system is hydration, nutrition, and sleep. But it's important for anyone out there to make sure you know the source of that video and that it's a trusted healthcare professional, or it's at least linking to a valid website. There are some red flags people should look out for as well, such as if somebody is claiming that you can cure your child of a cold in a day or two, or if somebody is selling something. These are some of the red flags we tell parents to be on the lookout for when they're going online to try information about how to treat their children. There is no actual proven RSV cure. We just have different forms of supportive care and treatment in some particular situations. But as of right now, there's nothing you can buy or make that is going to magically cure your child of RSV in one day. But it's also important that parents just take a step back, breathe, little reality check. The vast majority of kids with a common cold or RSV will not become severely ill, will not become hospitalized. But it is important that parents are on the lookout for those warning signs that may necessitate urgent care, such as altered mental status if your child seems extremely confused or sleepy, if your child appears to be very dehydrated because they can't eat or drink, and they're making less than one wet diaper every 8 hours, they aren't making tears, or they just appear very dry. But also, and most commonly, most importantly, if your child has any signs of respiratory distress, if you see your child using muscles to try and breathe, gasping for air, breathing very quickly, anything like this, you should seek medical care immediately. The most important thing for parents to do is actually look at your child and look to see, is your child still breathing comfortably? Is your child still able to eat solids or drink liquids? And is your child still acting normally? Is your child smiling, still playing, still seem like their normal self? And these are some of the most important indicators of whether or not your child is critically ill. Because if one of these is off, it's time to chat with the doctor. When my toddler has cough or congestion, some of the home treatments that we do immediately is we use a humidifier, either in the form of a cold water humidifier or even steam from the shower to help loosen up some of that thick mucus. We also rely on a nose Frida or any other nasal suctioning, using some nasal drops or nasal spray, and then actually sucking out that mucus so she can breathe easier. It's also very important that parents ensure their kids are getting adequate hydration. So when my daughter is sick, we make sure that she's still eating and drinking consistently, even if it's small amounts at a time. If parents have questions about purported treatments and cures that they see online, it's important to remember two things. Number one, chat with your doctor first before trying anything to make sure it's safe and it actually works. And also, if it's too good to be true, it probably is.